So today we'll start on the exercise science units. So the first unit we'll start off with is anatomy and physiology. So there'll be a few different units you'll be doing in this cluster. So it'll be a very engaging sort of area where we'll be doing lots of practical activities, going to the gym later on as well. So that's really good. Thank you to all of you guys for taking part in the video recordings today for my TAE. So thank you for signing all the documents as well, which is a massive help. So first we'll get started on, so at the end of this topic, you'll have an understanding to incorporate and understand the human body structure and physiology into fitness instruction, programming and provision of fitness advice. So you'll have an understanding of different anatomy throughout the course, physiology, and how to put sort of that into fitness prescription, exercise, take that into the gym as well, and take part in different areas. You also consolidate understanding of anatomy and physiology, applying knowledge to own professional practice. So whatever we teach you here, you can take to your work placement, which will be really helpful for you guys as well, and into your future job as well. Maintain and update knowledge of anatomy principles. So learning different principles such as actions of muscles, origins of muscles, insertions as well. So we'll sort of go into that a little later on the topic as well. So in the first cluster, you have been provided with an overview of the major systems in the human body. So you probably have all this information in your workbooks as well, all your assessments to go through. And you'll learn different exercise science principles in relation to exercise programs. So different exercises where you can structure a program at the end and deliver that to your clients or to your residents that you'll be working with as well. So anatomy review. So regions of the body. So we'll start going through this as well. So here they've provided us with a few videos. We'll watch the first one.
Hi there, it's Matt from Kentland, and in this video tutorial.
There we go, the sound. So we'll come back to them after. Structural levels of body organisation. So our body is made up of cells, tissues, organs and organisms. So they're the four different body organisations that they're made out of. So tissue types, we've got connective tissues, muscle tissue, nervous tissue, and also epithelia tissue. So if you look at the examples, smooth tissue, how it's connected in our involuntary control, cardiac muscle tissue as well, and skeletal muscle tissue. So normally we have different layers of skin. So there's 6 or 7 different layers of skin within our human body. So lots of muscle is occupied by lots of fascia. So fascia is thick underlying skin. So what I'm picking up here. Fascia it's very thick, it's very strong. There's 7 layers. It helps move muscles as well. So into different movements. That's a bit about sort of the connective tissue and the muscle tissue as well. So the muscular system. So have any of you guys probably seen this before, sort of gone through it? Yeah, that's really good. So we've got two different views of our body. So the first one here is anatomical view. So anterior means from the front, and posterior means from the back. So if we're talking and looking sort of at these two diagrams, this will be the anterior view of our body, and this will be the posterior view of our body. So our front line of our body and our superficial back line, what we have here. Yeah, so different muscle groups, as you can see, are made up. So our deltoid muscles, which are all our shoulder group muscles. We've got our pec major, our serratus anterior, which is under here. So a lot of them muscles we'll use for sort of protraction or flexion. So these muscle groups are pretty strong in boxers, we may find. Boxers have them big sort of muscle groups just because they're continuously doing that flexion phase all the time. We've got our rectus abdominis and our external obliques, so they're part of this chain of our body. So yeah, we normally get them always engaged in particular sort of movements, activity, exercise. We're always trying to switch them areas on. And then here we've got massive foundations of our body. So we've got hip flexors, psoas muscles. Our quad groups are made up of quads are made up of 4 muscle groups. So we've got rectus femoris, vastus lateralis, and vastus medialis. So vastus lateralis would be here on the lateral side. So lateral side meaning lateral side of our body. Medial side would be the inner part of our body, so vastus medialis, and rectus femoris is straight down here. So they're sort of the different quad muscle groups. And you'll be using these terms a lot in your job and in placement as well, dealing with clients as well, looking at different movements, so that's really good. And then here we've got our lower extremities. So I normally refer to lower extremities from sort of our knee down. So we've got tibialis anterior, soleus, gastrocnemius, and tib post, so tibialis posterior. So we've got gastrocnemius is probably the majority of the bulk up here that we find. So massive in sort of runners, same as soleus as well. Soleus, we have to go through gastrocnemius to find that and to bring that up as well. And then tib post is pretty much through the superficial sort of layer, so we've got to go deep underneath here, and tib post is sort of around here as well. So that's the anterior view, and then the posterior view. So I've got traps, massive sort of muscle group right here. We all probably tend to feel sore throughout these areas, you know, sitting down, studying, or working behind a desk. That will come up as well. We've got our triceps right here, biceps on this side. And then we've got our whole rotator cuff shoulder group, so infraspinatus, teres minor, teres major. So they're all located all around here. So teres major, minor, infraspinatus is around that scapula. So our scapula is what will move our shoulder, sort of up, down, left, right as well. A rectus spinae group is right throughout our back here, so they're our strong back muscles that you'll find. And then we've got our glute muscles, so made up of sort of a few muscle groups. We've got gluteus medius, gluteus maximus as well. We've got probably one that isn't listed here, piriformis, so that's more deeper in there as well. So yeah, they're massive foundations. If we sort of don't have a good sort of glute, if we don't have good glute strength, we'll lack sort of back strength as well, and vice versa. So our glutes need to be strong for our lower back, and vice versa as well. Here we've got our hamstrings group, so semimembranosus, so it's more that sort of inner hamstring. Adductor magnus, so it's probably hard to sort of pick out there because they've labelled it up here. But adductor magnus is more right here, so wraps sort of more anteriorly throughout the quad. So adductor magnus, and then adductor longus goes underneath. So the way I like to remember them, adductor longus is the longer adductor, and then magnus, just make sure that's the shorter one, so you can remember it like that, which is nice and easy. Perfect. So here we've got our skeletal systems, so axial skeleton and appendicular skeleton. So the axial skeleton is skull and facial bones, sternum, ribs, and vertebral column. So this is all obviously underneath our muscles, what will come up as well. So we've got the skull and the facial areas, so there's lots of muscles throughout this area as well. We have our sternum, which is around here, it's located, so sternum and clavicle is around here. And then we've got our ribs, so our rib cage will come over them sort of muscles that we went through before. So rectus, abdominis and external obliques, so our rib cage will go across there and also back here underneath our extensor, so our back muscle groups. So we'll start on the shoulder and upper limbs. So the function is provide attachment points for upper body muscles, allowing multi-direction movement. So different muscles that we'll find is glenohumeral joints, which are throughout here as well. So the shoulder, they allow us to do different movements. So the different movements will be flexion, so we're going straight up like that. So that means our shoulder blades and our scapula is moving into a flexion phase. We've also got extension, so going back like that. We've got abduction, so coming up and around sideways. And then if we start off at 90 degrees, we've got internal rotation of our shoulder and our scapula. We have also external rotation, and then we've got a few more. So horizontal abduction, so going up and then across our body. So they're probably the prime movers that you'll look for. So you'll go through a series of tests with maybe residents that you'll do on placement and also in your job as well, and then looking at their movements, so how sort of effective, smooth their movements are as well. So we're looking at all that. Just the more we test, the more it's going to sort of pop up, and we're going to find things that will make it easier to sort of treat and go from there. So major muscles, like we were stating before, so pectoralis, we've got deltoids, we've got traps, we've got rhomboids up and around here near the scapula as well. Serratus anterior is throughout here. Latissimus dorsi, so another main sort of prime mover of our shoulder. And we've got our rotator cuff muscles, so they're the infraspinatus, teres major, minor, and supraspinatus in there. And then also small muscles on the scapula which support the joint. So some that we've covered will support that area as well. Any questions so far at all? No? Everyone's sort of along with me yet? All good? Following yet? Yeah, that's good. So here we've got the shoulder girdle bones. So here, superior angle, so more on the top there. Inferior angle is on the bottom as well. Supraspinous fossa. So different sort of shoulder girdle bones that will assist movements for the muscles as well with different ranges. So shoulder girdle muscles again. So throughout the shoulder we sort of covered these as well. Traps, rhomboids, pec minor, sternocleidomastoid mastoid, we didn't cover that one. So sternocleidomastoid mastoid is a deep neck flexor muscle. So that's found here. So if you try and grab that on yourself, so if you turn, so laterally tilt your neck to that side, grab that sternocleidomastoid mastoid and then turn that opposite side. Do you find that sort of feels young throughout there, and that's hard to pick up, that muscle group? So that's our SEM. So sternocleidomastoid mastoid, you can shorten it to SEM. So it's a bit of a long one and a hard one to say, but I normally refer to it as SEM. We've got our pec major. So our pec major is located around here, and then we've got our pec minor, which is on top right here as well. So both of them, movements-wise, they more do flexion. So flexion will bring up both pec muscles if we're wanting to find them as well. We've got lats as well, deltoid group, which we've covered. Them rotator cuff ones, so them four important ones there. So if we look around here, so infra, teres minor, teres major, so all around that shoulder girdle as well. So here they've just listed out again for us the posterior view of each other, of the muscle, sorry. So yeah, again, traps going throughout this layer of fascia, infraspinalis, teres minor, teres major, triceps as well, and then all throughout our erectors, our lats curving over here. Yeah, so sort of it's good to sort of read over these as well, you know, throughout your workbooks, going on the internet, printing off charts is a really good one, putting up charts in your room and just sort of trying to go over it every day to get familiar. Yeah, because this is probably, yeah, it's very vital to know your muscle groups, just so it's easier for your, you know, treatment, what you're doing at placement, yeah, what you're doing at your job as well. So it's really important. So ligaments here. Has anyone torn a shoulder ligament before? Would anyone know the feeling of that? Yeah, so pretty excruciating. Yeah, so I've never done it before. Don't hope to ever do it. But yeah, once we tear it, the whole muscle can come off the bone as well. Yeah, so you might see this a lot in footy players. It's quite common for the muscle to be torn right off the bone. People that are doing sort of, you know, skating, skateboarding, massive falls. Yeah, so you can tear things like your labrum, your bicep tendon, so actually tearing your whole bicep. So yeah, that's pretty bad, tearing that. Recovery for something like that could be, you know, up to 2 months, even up to 6 months, just sort of depends what you do in your rehab phase, but it can be pretty intense with things like that. So rotator cuff muscles, again, supraspinatus, infraspinatus, teres minor, and subscapularis. So subscapularis, we didn't touch on that before, but subscapularis, you can actually find it underneath your armpit. So I'm a myotherapist, that's my background. So yeah, it's sort of similar to an osteo and physio in a way. Yeah, so treating subscap on people is pretty intense. So sort of finding it underneath your armpit, digging in, and then adding in external rotation, and then you'll find the subscap. Yeah, so that's a big rotator cuff muscle group and helps with a lot of movements as well. So anatomy of the shoulder. So here you've got bones. So scapula, clavicle, and humerus. So scapula was around here, so closer to our spine, and clavicle was up in here, so them regions. So the main muscle groups for them are again deltoid, teres major, pec major, latissimus dorsi, traps, rhomboid, so a few listed there, and the ligaments for each one as well. So glenohumeral, superior, inferior, middle. Yeah, so these terms as well you'll learn sort of down the track. Yeah, so superior and inferior is up and down, and then the joints, so scapular, thoracic joint, sternoclavicular joint as well, and then the movement, so what we were saying before, so again flexion as well, extension, so they're different phases, and then abduction, so always remember abduction, we're taking away from the body, so away from the midline, and then adduction, so we're adding, so we're bringing towards the body. So that's how I normally remember them as well. And circumduction is where something will go right around, so circumduction. So here we've got muscles, origins, insertions, and movements. So each muscle has an origin, so where it originates from. So normally to remember this, where it comes from. Insertion, what it's inserting into, so throughout our body, and then movement, so a different range of movement. Yeah, so whether it's external rotation, adduction, extension as well. So here we've got deltoid. It originates from our clavicle and also our spine of our scapula. So the spine of our scapula, if you guys try and palpate, so palpate means feel. So if you guys try and palpate right throughout here, you'll feel like a mini spine. So it should be just a bone going across. Do you feel that at all? If you sort of palpate around that area? So maybe I'll try over here. So if you sort of palpate, so you might find the spine in here. Do you feel that now? Yeah, so that's our spine of our scapula. It's a bony landmark. So if you feel it, you'll easily feel it and it will pop up. So that's our spine of our scapula. And upper part of our humerus. So our humerus is up here. So that's where the muscle inserts to. So that's where our deltoid goes into the humerus. And then the movements, so abduction, so taking away from our body. Extension, so going right back. And then lateral rotation as well, lateral rotation. And then medial rotation, so coming inwards as well. So they're different muscles, origins, insertions, and then we've got the same for teres major as well. So infraspinous fossa, greater tubercle of humerus, and it does external rotation. Same with pec as well. So with pec major, we've got our sternum and clavicle, so 1st to 6th ribs. So if we start here, so if everyone sort of palpates through here, and then go down sort of maybe an inch, and then press, that's our 1st rib, right? And then if we go drop down again, that's our 2nd rib. So we'll palpate all the way down to our 6th rib. So that means we know pec major, this muscle group, is from our sternum to our 6th rib, so that's that area it will cover. Upper front area of humerus, so it inserts into this area, so that's our humerus as well. And then it does adduction, so it comes towards our body as well. It does flexion and then medial rotation as well of our arm. So here we've got continue on with traps. So origin, cervical and thoracic vertebrae, base of skull. So our trap, to simplify this, it actually starts from our ear and it goes all the way down to the end of our shoulder point. So if you pincer that, so if you pick up that muscle there, really easy to grab, that's our trap right there. So nice and easy to pick up. So here, another one, rhomboids. So the origin for rhomboids is C7 to T5, so they're vertebrae in our spine. So vertebrae are small segments, bony, sticky outy bits throughout our spine. So if we go to around here, right? So normally to find C7, you'd look at finding C6 first. So C6 is the one that most sticks out, just sort of up until this point. So I'll put my finger here, so that's C6. If you rotate your head, so rotating means to right and to left, you'll know you're on C6. And then if we drop 1 and press it, if we press a bit of pressure, it doesn't feel too nice. So if we just press a bit more, so that's C7, and that will go to T5. So anything with C means cervical, anything with T means thoracic, and anything with L means lumbar. So there's 7 segments here for cervical, and then there's 5 in thoracic as well. So that's how we remember it as well. And then L is lumbar. So that's that there. Serratus anterior, which was that one here, we can refer to that as the boxer's muscle, serratus anterior, because it's quite strong in them, is anterior surfaces of 8 and 9 ribs. So if we start throughout our rib cage, so again, going through this area, so sternum, then rib 1, 2, 3, 8 and 9 ribs. So the anterior surface means that front surface of our ribs. Biceps, the origin of biceps is throughout our scapula, so around here. And then medial border of the scapula, so it will come right around, that's where it inserts into. And then the movements, it does flexion of the elbow. So if we look at flexion of the elbow, it's like that. So that's flexion of the elbow, extension of the elbow as well. Supination and pronation, so that's one we haven't covered. So supination, I always remember holding soup. So your palms facing up. So supination like that, and then pronation is the other way. So that's pronating. So if we want to supinate, we bring up a muscle like that. If we want to pronate, we turn our hand in like that. Levator scapula. So you can refer to this as left scap normally. So left scap will be the same on the right side of the body and left side. So it's not like left scap and right scap. It's our levator scapula, so left scap. So that's transverse processes of the atlas and axis posterior tubercles of C3 and C4. So again, starting up here, our base of the skull, if you find here where you won't feel anything, that's C0. So if we drop one, C1, another one C2, and then C3. So C3 and C4 is where levator scapula originates from. Where it inserts, where it goes into, is at superior angle and medial border of the scapula. So superior angle and medial border, so medial coming in of our scapula, so out through out there. And then again, elevation of the scapula. So elevation and depression, we'll cover these ones now. So elevation is shrugging your arms up, so that's elevation of your shoulders. Depression is dropping them down. So elevation of the shoulders and then depression of the shoulders. Yeah, so might be a bit of an overload today with sort of anatomy and physiology. You probably feel like that now already. But yeah, always sort of refer to charts, looking back at notes, asking myself, asking Steri as well. Yeah, so just going through different areas. Yeah, but it is, at the start, it is very hard to sort of learn a lot of anatomy and physiology-based content. So here we've got rotator cuff areas. So again, always, for every muscle, we always want to indicate the muscle, so where it is, where it originates from, so where it's starting from, inserts, where it goes into, and then the movement for each muscle as well. So teres minor is a lateral border of the scapula. So lateral meaning out, so the lateral border would be out here of the scapula. And then infraspinous fossa. So fossas are normally sort of round, built up things within the muscle. So that will be the fossa, so that it will originate from the fossa of the muscle. So infraspinous fossa is up here, and then supraspinous fossa is where the supraspinatus is, so lower down. So anatomy of the elbow. So here we've got humerus, radius and ulna. So humerus we touched on was up in here. So radius and ulna, so if we, with our hand, radial deviate, so that means we're coming in, that's radial deviation. And then ulnar deviation is going out the other side. So radial deviation is coming in, so that means our radius is throughout that side. And then our ulnar, so ulnar deviating is through that ulnar side of our elbow. So that's how we remember it as well. Forearm flexors. So forearm flexors are anything that will flex our forearm, and forearm flexors are throughout this side of our forearm. Forearm extensors are throughout this side here. So anything that we're going to extend through our wrist or through our upper forearm is on the extensor side. So extensors and flexors. So different ligaments as well. So MCL, LCL and annual ligament. So they're different ligaments within our forearm groups. And then we've got our joint movements as well, which is commonly a few sort of movements more throughout the forearm. So it's generally flexion of the forearm, extension, radial deviation and ulnar deviation. So they're sort of the four movements that we normally perform through our forearms to sort of bring up muscles as well. Anatomy of the elbow, so forearm flexors and extensors, what we were just talking about. So for forearm flexors, they all originate from a common tendon from the medial epicondyle of the humerus. So the medial epicondyle of the humerus is around here. And then forearm extensors are from a common tendon from the lateral epicondyle. So the lateral epicondyle is around here as well. Insertion, so common attachments to the wrist, so distal end of radius and hands. So distal end of the radius, so on that radial side of the hand as well. And then normally the movements are extension and abduction of the wrist. So again, so extension as well, and then abduction will be taking away. Here we've got again, so anatomy of the wrist and hand. So different bones listed out here. So carpals, metacarpals and phalanges, they're found in our fingers and also our feet. So little muscles and bones, little bones found in our hands and in our feet as well. So normally, if you go sort of in depth with runners, we might not sort of focus on them a lot, getting them switch on, but someone like a professional runner, a 100-meter sprinter, will look a lot to engage and get their power from their phalanges, carpals and metacarpals as well. Main muscle groups, so wrist flexors again, so wrist flexors, extensors, and finger and thumb flexors and extensors. So extensors of the thumb and flexors of the thumb as well. Different joints as well, and joint movements, so predominantly flexion and extension movements for them. Anatomy of the wrist and hand. So here you've got back, spine and core, so different layers throughout the area. So if you can see that picture on the left, we've got cartilage as well, vertebrae, facet joints, and intervertebral discs. So this is a good one to focus throughout our neck. So the vertebrae are the sticky outer bits we were palpating as well. They're all the vertebrae throughout our spine. Next to the vertebrae, so this is the vertebrae, next to the vertebrae we have spinous processes as well, so they stick outwards that way. So every vertebrae will have a spinous process next to it. On top of this, on top of the vertebrae and the spinous processes, we have cartilage. So cartilage that will protect that area, and also fascia. So fascia was skin that covers muscle bulk as well. And then intervertebral discs, so discs that will fall within sort of that facet joint. So they'll be coming in and connecting in that area as well. So the problem, if these aren't functioning right on people, we can have spinal surgery, we can have restricted range of motion as well. So range of motion is how many degrees we can hit. So for example, rotation, like that. So someone with vertebrae and spinous process problems, for example, their range might be like that. So very, very limited. And they might have things like bulging discs, they're different conditions. So these might not be in its place properly, might be sticking out or sort of misplaced within their body, and that's what's causing them these pains, these lack of range of motions as well. And they all come in different shape, size and function as well. So different sort of vertebrae as well, spinous processes will be different within everyone. That's how our bodies are sort of created and formed as well in different ways. Perfect. So here we've got the vertebral areas, so the rectus spinae group. So we've got longissimus, spinalis on the bottom, and iliocostalis. So these three muscles make up our rectus spinae group. So these three. So iliocostalis, longissimus, and spinalis. So longissimus is more closer to the spine. Iliocostalis is in the middle, and then spinalis comes on that side as well. So three different muscle groups. They're very thick in fascia and skin as well. So a lot of us would get sore around here and need treatment around here as well. And they all originate from different areas. So iliocostalis is from our ribs and our iliac crest, so which is around here, our iliac crest. And then our longissimus is transverse process of the cervical, thoracic, and lumbar. So longissimus is huge, so it pretty much covers from our cervical, so anything in our neck, our thoracic, anything in the middle of our back, and our lumbar, so anything low down. So longissimus goes all the way up and across. So it's a long band of muscle tissue as well. And then spinalis is spinous processes of the cervical, thoracic, and lumbar vertebrae. So pretty much the same, starting from our neck all the way to our lower back. So a long band like that. Insertion for iliocostalis, so transverse processes of the cervical. So it will go into our cervical and also our thoracic and lumbar vertebrae as well. So pretty much covering C7, C1 to L12, so that whole sort of group of spinous processes. And same with longissimus and spinalis as well. Quadratus lumborum and multifidi. So these are muscles close to our lumbar. So multifidi is pretty much a muscle right near our lower spine, so throughout here. So that's our multifidi. And then our QL is lateral here. So that's our QL. So you can shorten it to call it QL, or the full name of it is Quadratus lumborum as well. So here the insertions, so upper four lumbar vertebrae. So the upper four lumbar vertebrae segments, which will be around here, so L1 to L4, and the lower margin of the 12th rib. So it borders the 12th rib as well, and it goes through vertebrae L1 to L4. So that's what it inserts into. And multifidi is spinous processes of 2 to 4 vertebrae of superior to the origin. So different actions. So as you can see, these are prime movers of our body, so they'll be doing a lot of different movements. So flexion of the lumbar. So flexion of the lumbar, how we test it, arms by our side, and then just going straight down like that. That's flexion of the lumbar. Extension of the lumbar will be 2 hands on our lower back, and then we're going into extension, just like that. Lateral flexion, 2 arms by our side, tilting down to the right, so we're seeing the lateral side movements, and then going to the left as well. So they're different areas as well. So that's how we test lumbar, and then how we test thoracic. So thoracic meaning, again, the middle of our back. So the same movements, but we do this sitting down. So the reason why we do it sitting down is not to incorporate our lumbar, our lower back. We just want to target the thoracic. So arms crossing our chest, that's thoracic flexion. And then coming back to the middle, thoracic extension as well. And then thoracic lateral flexion to both sides. And then thoracic rotation as well. So that's how we do that. So normally that phase is done seated to test thoracic, and then lumbar is done standing. Also to test our neck, so our cervical, we do seated as well. So cervical will be cervical flexion, like that, cervical extension, and then cervical rotation, so turning our head to either side, and then cervical lateral flexion, so right ear down to right shoulder for that right side, and then left ear down to left side. So a lot of these muscles we were looking at before, so for example, traps. So if we do that movement, cervical flexion, traps will engage. So trapezius muscles will engage. Extension as well, that might be traps. We might have some feeling throughout our thoracic, so our spine groups as well. And then rotation as well, that can be more levator scapula. So the one that's beneath traps. So that's that one there. And then sternocoid-mastoid, which we know as SEM, that shortened abbreviation version. So if we tilt our head like that, that will bring up SEM. So that's one here, and then tilting to that side. Yeah, so that's how we sort of put our muscles into their movements. So whatever movements we're doing, different muscles will come up. So there are some examples there. So it's important we do that. It's important we do always testing on our clients, just to know what we're going to treat, what we want to look at during their program, during their exercises, and that way, testing, if it brings up pain on movements, we know, right, with this exercise, we can drop it back because it's too hard for them. Or if this exercise, you know, their movement's good, let's make this exercise a bit harder for them. So testing is vital just to find out more information about the human body. So bones of the vertebral column. So like I was saying earlier on, the 5 regions. So cervical, we know that as C always. Thoracic, we know that with the letter T. Lumbar is L. Sacral is lower down, so that's sacral area. And then our coccygeal, so coccyx is around sort of this region here, around that hip region. So that's where we find them 5 regions. And then again, we've got here, we've got that vertebral column, and then you can see it's divided into 3 areas. So cervical, thoracic, lumbar as well, and then throughout here we'll have our ribs as well throughout this area. Yeah, so you can remember this as with cervical, at 7 o'clock we have breakfast, and then lunch is at 12 o'clock, and then dinner is at 5 o'clock. So that's a nice sort of easy way to remember it. Yeah, so 7 o'clock breakfast, lunch is at 12, and then dinner's at 5. So that's how we sort of remember cervical, thoracic, and lumbar. So that's probably the easiest way how to break it down. So bones of the vertebral column, and then back and neck stability. So core strength. So like I was saying earlier as well, so our back, so if we want a healthy back, we need good, strong core muscles. If we don't have good, strong core muscles, then we'll have a lot of back issues. So the ones that we have to strengthen throughout our core would be transverse abdominis, internal obliques, pelvic floor muscles. So pelvic floor muscles are sort of around our hip flex area. So these muscles are important. For example, if someone gives birth, that pelvic floor and stability area needs to re-strengthen again. So we need to strengthen the core as well from carrying the baby and pelvic floor issues. So that takes a lot of time to strengthen that pelvic floor area. Yeah, but over time that will get strong again. Our abs will get strong, and then that means our lower back will get stronger as well. And then multifidus was that muscle right near the spine. So we look at the spine straight down the lumbar segments laterally, so on both sides. That's our multifidi muscle group. Perfect. I reckon now we'll have a break, and then we'll continue back on after the break. Just probably everyone's heads are quite heavy from all this, so yeah, we'll have a break and then we'll continue on after. Beautiful.